And a great track there from Coloured Stone, Dancing in the Moonlight. And we're going to be catching up with our first interview today. And he's the clinical advisor at the Australian Digital Health Agency, and that's Dr Steve Hambleton. And he's, as they're saying, supporting improving healthcare for Aboriginal and Torres Strait Islander people. And they've got a trial, a new tool to help them manage their healthcare with the launch of a pilot program in Perth, and it's called GoShare digital platform. And we've got the Dr Steve on the line. Hey, Dr Steve, welcome to the program.
Thank you very much, and good morning, everyone.
Yes, no, good morning to you. How did this all come about with doing the GoShare digital platform? Where did that come from, the pilot program?
Well, it's a pilot program to help provide education to patients and at the hospital in the Midlands. And, of course, St John of God noticed that it was very difficult to get the message through clearly. You know, and we know that when you spend time with your doctor, we tend to tell you stuff. And then when you go away, sometimes it's very hard to remember what we've said. And we want to make sure that we provide plenty of information to people, sometimes in their own language, which makes a huge difference, but certainly something that you and your carer can actually understand. You know, and I know that when doctors talk, sometimes it doesn't make any sense.
That's true. You know, sorry about that.
If I said to you that you have to take your antiplatelet agent and your statin to reduce the risk of platelet aggregation, which complicates cholesterol deposition in your coronary arteries, I might go home feeling pretty good, but the patient might say, look, he was a nice guy, but I haven't got a clue what he said.
Yeah, no, it happens, and it's not just with our people, it's a lot of people. A lot of people talk to me and they said, I've got medication, but I'm too scared. I said, well, did you ask the doctor what the side effects were? And they went, no. And I said, well, this is what you've got to do. And they, sometimes the doctor mightn't even be able to tell you, but you really need to know what the side effects are. And depending, especially our mob too, because of our DNA is very different, and we're all made up from all across the world with different DNA. So it's really important that people do ask questions. I just wish there could be signs in doctors' offices. Please ask me if you don't understand, or, ask me what the side effects are, because they don't know until maybe they go home and a couple of days later they're throwing up or something's happening. And, it's really serious. And it's great that you said you do put it into language. Do doctors actually do cross-cultural awareness? Do you, within the area that you're in, do you have cross-cultural with the local mobs?
Yes, we do. We try to do that all around the country. In general practice, you can actually enrol in mainstream general practices, and those practices are required to do cultural training with the local mob, so they understand the history and understand the antecedents. Unless you know what language people are speaking to locally. I mean, a lot of places, obviously, English is very good, but often English is a second language. And that's really difficult. And if someone tried to speak to me in a second language, I'd have all sorts of trouble. And speaking louder and speaking slower just doesn't work. So this digital platform, look, it's sent out by SMS, by text message. It's sent out by email, and you can take your time. You can listen to people talking about their experience. And I think that's so powerful.
But also, too, not all our people have, technology. So how does that work with people that don't have technology?
Well, you're absolutely right. And sometimes people have got a phone, but they haven't got a data plan to actually get that message. Pleasingly, we found a lot of people around that area do have at least phones we can get a text message to, and most of the messages are coming out by SMS rather than email. But that's something we need to fix as well, and if you like, that digital divide. So, you can spend some time looking at these information packs in your own time with your carer, so you can, figure out which questions to ask and what to do and how to engage.
Okay, why is that the reason why you picked Midlands to do the pilot program?
Well, it is. And the Midlands pilot program's worked really well. We've had over 1,000 patients actually access that. It's working in the emergency department, it's working in the maternity unit, and it's working in the mental health area. We've got a number of people so far that's found about 90% of the emergency department patients are finding the bundles that we're sending out either helpful or very helpful. And those maternity patients, something like 80% of those are finding them helpful or very helpful as well.
Wow, that's pretty good going. What about, now you say at the hospital, so that means that they're referred, have they got an Aboriginal medical service there?
They do. They have an Aboriginal medical service, and they worked with them to actually approve the programs to make sure they're culturally appropriate. It's really important that, well, actually, they've worked in collaboration with all four. The Digital Health Agency, who I work for, Healthily, who actually created the application, and St John of God, as well as the local Aboriginal Health Centre. And that makes all the difference when you work with the partners.
Now, just an idea just popped into my head. We're doing that for adults. Are we doing anything in the schools to bring awareness there for younger people as well?
Well, I think that is the big challenge. I mean, we know that healthcare, Aboriginal people suffer a significant illness much younger than the mainstream people in Australia, and we need to actually start that education early. Health is more than just health, as you know and I know. It is about the environment, it is about housing, it is about a job, it is about all of the things that go along with it, connection to country. And these are the sorts of things we need to start early. And every portfolio needs a health impact reflection to make sure that we're engaging appropriately. And I think the earlier we start, the better.
Now, this sounds interesting. So when does this kick in, or has it already kicked in?
Well, it's already started. It's running, and it's really Minister Wyatt launched it officially recently, but it's already going. And we're hoping that this pilot becomes, an ongoing funded issue. And so far, the results are really, really positive. And I think we've got about 1,000 patients have received the bundles. About 630 of those have already sent out. If we can actually find that this is very useful to the community, it's something we should really support ongoing.
And when will it start to roll out? How long is this pilot program going to take, and when will it start to roll out right across the country?
Well, this one will be completed by December this year, and it's been slowed up a bit because of COVID, but I guess everything's been slowed up a bit because of that. But so far, looking really positive. Healthily, the company that's put this GoShare platform on the table, has developed its own resource. The hospital has developed some resources as well. And so they're all available, and I'm hoping that, it doesn't stop like some pilots that we see. I'm hoping it is able to be funded in an ongoing way, because I think it will make a difference in health outcomes, because people will understand their health problems better. And when you understand them better, you actually know which questions to ask, and that's what do they call that? A virtuous cycle, not a vicious cycle. And that's what we need in healthcare.
A virtual cycle.
There. Oh, well, virtuous. Cycle.
Yeah, virtuous. Yeah. No, see, there's another one. What does that mean to a lot of people? Virtuous. So we've got to be really careful how we use our words out there. It's like the start of COVID, social distancing. A lot of the language that they're using in the mainstream is not language that they're using in the mainstream people really understand.
Well, that's right. And when you think about it, we actually don't want people to social distance. We want them to maintain contact with their family, their friends and their relatives, but we want them to be physically distant. So, 2 steps away most of the time, particularly when you're out. And that hand washing, there's nothing like soap and water. I mean, it kills the bugs, takes about 20 seconds. So people are humming, songs to themselves when they wash their hands. Can make all the difference. And, making sure we cough into our sleeve rather than into our hands, keeping the hands clean, it's going to make a difference with this virus.
Another thing I always ask is the doctors yourselves. You're out there amongst the public. Do you have concerns, or your family have concerns with you coming home?
Well, look, that's a really good question, and the answer is yes, we did originally. And I come from Queensland, and I'm a GP, so we're lucky in Queensland that we don't have a lot of circulating virus. But when it first started, I used to come home, go straight into the shower, have a shower, make sure that I didn't contaminate anyone at home, put the clothes I was wearing at the surgery somewhere different. And now we've relaxed a little bit, but people in Victoria have really done it hard, and a lot of healthcare workers, people caring for people at the front line have got ill, and that's been a big challenge to keep families safe, to keep the medical people safe, the nurses, the doctors, the wardies in the hospital, the cleaners, all of those people are at risk on the front line.
Yeah, no, it is because everyone's talking about the public, but I know friends that have doctors that do home visits, and they're going from one to the other, all day long, all week long, and these are not young doctors. These are doctors over 50 and 60 that are out there.
Well, that's right. And, Look, and the other thing that's come in is the video health. You can talk to the doctor over a video. You can talk to the doctor over the telephone. That has been a really big help, because if all you need is a repeat in your medications and you know the doctor and the practice pretty well, we can talk to you over the phone and solve that problem. Getting the videos to work is a bit of a challenge, but when we get it working, that is really helpful, because you can see the doctor, they can see you, and that can make a big difference. You don't have to actually go to the surgery every time to get some routine care if things are going well.
Okay, then. So this program is just in the Midlands. It'll be there until December. How do people keep up to date? Is there a website or a Facebook page that people can update themselves with?
Look, I think the hospitals certainly got it advertised on their web pages. I've had a look at that, and they're highlighting the package. The local health centres know it's happening. The MDM maternity service is keeping all of its patients informed. The Jari Mia and the St John of God Midland Hospital are actually keeping all the patients informed. The emergency department's reminding people that the program is there. And the good news is they can tailor it to the individual. You know, if you need specific information, they can get it to you, and make sure you can spend some time just reflecting on it at home in your own time.
No, that was good the way you pronounced that. The Aboriginal Maternity Service. That's very, very good that you spoke the language properly there. Look, Dr. Steve, thank you very much for coming on the program and keeping us updated. So for all the mob over there in WA, this is a great pilot program that's happening, and hopefully it will continue and spread right across the country. But once again, thank you very much for coming on and keeping us informed what the Australian Digital Health Agency are doing.
Yep, thank you very much.
Thank you.